Very interesting. So I'm joined this morning by Wyoming Republican John Barrasso. He's the vice chairman of the Senate Republican Conference. He is also an orthopedic surgeon, so he brings a lot of expertise to this discussion. Good morning, Senator Barrasso. Good to have you here.
Thanks so much for having me, Martha.
So first off, what's your reaction to the decision?
I agree with it. I was saying that on the Senate floor when we were debating this health care law that was being crammed down the throats of the American people. I believe it is constitutional. You can provide health care, and we have a lot of ways to do it without trampling on the Constitution. The American people know that, and this is much more than just about health care. It's about our liberties and our freedoms.
You know, we heard Senator Durbin moments ago before we went to the commercial break. He says, look, if you're keeping score in this fight, it's 2-1 in terms of judicial decisions in favor of this reform. That they've got 2, and this is 1 on your side.
Well, there's going to be a hearing in Florida coming up this month. We know, actually this week, we know that 5 new states will be joining in suits after the new governors are sworn in January. We have a long way to go. This will ultimately get to the Supreme Court, I believe, and I think we'll hear from them probably right in the middle of the presidential election in 2012, Martha.
Yeah, which would be very interesting timing on all of this. You know, you look at the polls, 60% of Americans, according to a recent Rasmussen report, said that they, at least want to see changes. They're not happy with the bill that was voted on.
Well, they know that this is a bill and a law that's bad for patients. It's bad for the providers, the nurses and doctors taking care of those patients, and it's bad for taxpayers and small businesses. You know, it's interesting. Former President Clinton was at the White House just on Friday with the press conference with President Obama. Then President Obama left, and Bill Clinton said, he said he could, off the top of his head, think of 4 or 5 things that he would do to change the health care law. This is a bill and now a law that is not the way to go for this country. It is harmful. It's going to lead significantly to huge expenses, and I think it's actually not going to make health care any better and really worse. And when I talk to patients, and I was home in Wyoming this past weekend, people are worried that their own costs are going to go up because of this law, and the quality of their own care is going to go down.
Yeah, since you brought it up, I found that news conference really fascinating with President Clinton. How much impact does he have on this whole discussion, do you think?
Well, it's hard to know. There was an editorial today by the Secretary of Health and Human Services. Her thoughts: she's now granted 222 waivers to over 1.5 million people that are from groups that supported the health care law but don't want to be have to work underneath it and live under the laws. So it's hard to see how much impact former President Clinton is going to have. But if he says off the top of his head he can think of 4 or 5 improvements, I can give you 5 right away. And those are: let people buy insurance across state lines, let people write off the cost of the care from of their insurance if they buy their insurance individually, give individual incentives, let small businesses join together, and deal with lawsuit abuse, which hasn't been dealt with at all in this law, Martha.
No, absolutely it has not. Let's listen. Howard Dean weighed in on this morning. He had kind of a different take on the whole thing. I want to get your quick thought on it before we leave. Let's listen to this.
I think the decision is not a bad decision. The first thing is that the mandate is not essential. That was principally a benefit for insurance companies. It's absolutely not essential. The judge limited his decision to this particular clause. He did not declare the bill unconstitutional, just this piece of the bill, and he specifically said in the decision that this doesn't apply to the entire bill.
He's arguing this is just one little fine point in this reform, and that it doesn't have an impact on the overall health care reform.
He says the mandate is not essential. The New York Times front page headline says core component of health care law found unconstitutional. The core component. I believe it is the heart of the bill, and if this is unconstitutional, it's going to be a bullet to the heart of Obamacare.
All right, a physician and a senator, John Barrasso, thank you very much. Good having you with us this morning, sir.
Thanks, Martha.